Have you ever wondered about how the medications you take for one part of your body might affect other vital organs? It is a great question to ask, especially when it comes to long-term treatments. Today, we are going to explore the relationship between popular cholesterol-lowering medicines and your liver health. When taking statins, a class of medication widely used to manage high cholesterol, the liver risks are generally considered to be low and often temporary. While it is true that statins can cause a mild, transient elevation in liver enzymes, for some individuals, serious statin-induced liver damage is very rare. For the vast majority of people, the benefits of statins in preventing heart disease and stroke outweigh these minimal liver concerns. Your liver plays a central role in metabolizing medications, including statins. These drugs work primarily by reducing the liver's production of cholesterol. In some cases, this process can lead to a slight and usually temporary increase in liver enzymes, such as alanine aminotransferase, or a LT, and aspartate aminotransferase, or a ST. These elevations are often harmless and resolve on their own, even if you continue taking the statin. The more significant concern of drug-induced liver injury, or DILI, which is a rare but severe liver reaction, is not typically associated with statin use for most people. Researchers believe individual genetic factors or other existing health conditions might play a role in the rare instances where more significant issues arise. So, what can you do to be proactive and informed? If your doctor prescribes a statin, it is important to discuss your medical history, especially any liver conditions you may have had. Your healthcare provider will likely recommend baseline liver enzyme tests before you start the medication and sometimes again a few weeks or months into treatment. If these enzyme levels show significant or persistent increases, your doctor might adjust your dosage, switch to a different statin, or explore other cholesterol-lowering options. The key is open communication with your medical team and never stopping your medication without their guidance. It is fascinating to know that the liver is incredibly resilient and capable of regenerating its own cells, which helps it manage minor stresses like temporary enzyme fluctuations. The scientific community has extensively studied statins for decades, and the consensus is that they are highly effective for cardiovascular protection with a well-understood and generally favorable safety profile. The rare severe liver issues, which fall under the umbrella of drug-induced liver injury, are carefully monitored and managed by healthcare professionals. This thorough understanding allows doctors to prescribe these life-saving medications with confidence, while also watching out for any potential, albeit uncommon, side effects. Ultimately, taking statins as prescribed is a powerful way to protect your heart and blood vessels from serious conditions like heart attacks and strokes. By staying in touch with your doctor, attending your regular checkups, and getting your recommended liver enzyme tests, you are taking an active role in your health. This approach helps ensure you receive the full benefits of your medication while carefully monitoring and addressing any potential, very rare, liver-related concerns.